Okay, it worked.
All
There we
right.
go. Awesome. Okay, I think there's a bit of a lag here, but you can hear me and see me okay, I think. So let's get going. Welcome, everybody. My name is Kim Bopney. Most of you guys know that. And I am welcomed today by Dr. Juan, MD, and he is going to talk all about, well, I'm hoping he will enlighten us all about fiber and gut health, and particularly constipation, as that's something that we talk about a lot in this group. So Dr. Juan, I want to hand it over to you. If you can kindly introduce yourself, tell us a little bit about what you do. And I met you on Clubhouse. I was in a room recently and it was all about plant-based eating and fiber. And I jumped over to your page and immediately wanted to have you on and learn more about your advice. So please introduce yourself and share all the information about what you do, and then we'll get started.
Yeah, absolutely. Well, Kim, first, thank you for allowing me to be on your page and then doing the Facebook Live. Truly an honor. And then I got to know you through your sites and Instagram as well as a Facebook page. Sounds like you do a really wonderful job for a lot of people and helping a lot of people. So I'm a plant-based orthopedic surgeon. Some people call me holistic surgeon, if there's such a thing. And we focus on regenerative medicine as well as doing surgery and a lot of conservative care, whether it is orthopedic related, whether it's a shoulder or knee pain or even spine. But what we started doing was not only just treating them for their orthopedic conditions, but we wanted to optimize their health so that they could recover from the surgery or the treatment. And so we focus a lot on nutrition. But how I got into whole food plant-based and really discovering the gut health is really a true source for optimal health is that I lost one of my dear friend to cancer. He was my anesthesiologist that worked closely with me. And we were pioneering a lot of minimally invasive surgery. And unfortunately, we both got exposed to tremendous amount of radiation because about 20 years ago when we started this journey, and the imaging system was fairly limited and we were using multiple X-ray machines to visualize. And then after he passed away, we used to joke around saying we'll probably get cancer someday, but obviously who wants to suffer from that? And so I really dove into the research that was available, which was ample amount, and certain things that we never learned in medical school or in medical training, how you can really prevent and then reverse many of the disease, and including cancer, for example. And MD Anderson, one of the best cancer centers in the world, when they looked at their patients and their studies, they realized that the diet was the #1 cause of cancer. Most people think cancer is related to genetics, but it didn't play more than 5 to 10%. And then #2 is tobacco, 3, followed by obesity, which always leads back to nutrition and diet, right? So what you put in your mouth really does matter. And then, and so through that research, realizing that even as a surgeon, I deal with many of the patients because patients that tends to have orthopedic issues, whether it is arthritis, spine issues, tends to be overweight. That also comes with diabetes, heart disease, some patients even cancer, and then even autoimmune disease. And as we were optimizing their body to get them ready for the surgery, many of them did not require surgery anymore, because they lost significant amount of weight, their pain went away, and most of it, even they have arthritis, it's treatment is mostly for the symptoms. And if they don't have symptoms, they no longer need the surgery, and they could avoid high-risk surgery to alleviate their pain. But also at the same time, these patients were coming back saying, I'm no longer on hypertensive medicine. I'm no longer on this medicine. Or many of the patients with type 2 diabetes, it was reversed. And then even some of the patients who've had autoimmune disease, which I believe a majority of them really starts from the gut. And because of the poor gut health, that develops into all the different types of autoimmune disease. And as you may know, that before 1950s, we hardly had any type of autoimmune disease. But with the development of processed food, and with so much easily available processed animal-based product and the pure animal-based products, that more people are developing autoimmune disease. And so we started incorporating the nutrition and lifestyle modification treatment to our patients. And many of them no longer need surgeries, and many of them are actually able to also reverse a lot of their medical conditions. So I truly believe that gut health is truly the center of our health, and which plays a lot of role in inflammation, brain health, heart health, and many other conditions. So therefore, not only am I a surgeon and practice regenerative medicine, but I'm one of the feel very, very passionate about nutrition and lifestyle modification to help patients not only manage, but in many times prevent and also reverse their disease.
Yeah, that's amazing. And I think that in the medical community, and you are obviously immersed in it, so you know more than me, but my experience in the medical community is there's not very many medical professionals who are embracing food and nutrition as part of their therapy. So I think that it's very refreshing to hear your approach and all the people that you have, again, as you say, prevented from even needing that surgery. And the other piece that I want to highlight on there that I love is you mentioned using food and nutrition to get their body ready for the surgery. So it's kind of like in my line of work, I talk a lot about prehab. So if surgery is something you are pursuing, we need to get the pelvic floor in the most optimal state to handle the surgery, but then it's an ongoing maintenance program after. And that's essentially it's a similar philosophy. However, you're using food to do that, which I really, really love. So one other thing you mentioned there, autoimmune. So myself, I didn't know a whole heck of a lot of information about autoimmunity until I found out I had an autoimmune condition, Hashimoto's, and changed my diet, took out gluten, took out dairy, did food sensitivity testing, got rid of inflammatory foods, took out caffeine, took out alcohol, and all of that, just everything started to get progressively better and better and better and better, to the point where now I have no more antibodies. My thyroid panel is completely normalized. I feel great. My digestion is better. Now I still have a parasite thing. So that's going to be another one of my questions, but talking about gut health, I don't want to say it is trendy right now, but it is a trend that I believe is here to stay, which I think is a good thing. So tell us about why the gut is so important, and how can it help with cancer and diabetes and heart disease and autoimmunity?
Yeah, so backing up a little bit, we have to understand what most Americans are eating, and truly the diet has changed. So 54% of American diet comes from processed food, and 32% from some form of animal-based product, and only 11% is fruits and vegetables, nuts and beans. But of that 50% of fruits and vegetables that the people get are from ketchup and French fries, which is completely ridiculous, right?
Yeah.
And then and maybe about 4% from whole grains. And so therefore, no surprising that we are dealing with 80% of the American population is either overweight or extremely obese. And 50% of the American population are either pre-diabetic or diabetic. And that is really the root cause of the problem. And you mentioned a lot of the physicians are not embracing because they don't know what they don't know. And when I was in medical school, as I mentioned, and during the residency, we never talked about nutrition. And then, even when somebody's going through a surgery, that is one of the biggest stressor in their body, then you want to optimize it. We get medical clearance. Is their heart strong enough? And if they have any other conditions, hypertension, diabetes, let's get them regulated, typically with medicine. However, we really optimizing their body. And that's what we focused on. And when we were able to observe that as their conditions improve, even the patients who still needed surgery, they recover so much better. And what we eat has a direct consequence to our gut health. And it's because there are over like 100 trillion bacteria and parasites and other microbiomes in our gut. And so there is, the ratio wise is 10 to 1. So really we are a host to the microbiomes, and 90% of the microbiomes that we have in our body resides in the colon. And so what we do, our lifestyle, when we sleep, how long we sleep, what we eat, what we drink, all has direct consequence. And so since they are the true boss, right? And then because we're really the host for them, that we got to make them happy. And because they play such a critical role. The microbiomes play roles in our metabolism that could lead to obesity, diabetes. They regulate our immune system and also central nervous system. And they also help us produce so many different molecules that we critically need in our body, such as short-chain fatty acids. They metabolize drugs if we take them. They neutralize toxins, and they maintain. This is very important. They maintain healthy gut lining, because many people probably heard of a leaky gut, and that's in medical terms the high permeability cell lining. And so the space between the cells are loose, so that the different toxins and food particles can actually get inside to the bloodstream, and our body recognizes it as a foreign object and starts attacking it. That's usually the first stage of autoimmune disease. And when those protein structures that invades through has similar structure as our own, then our immune system starts attacking our own body. And that's what the autoimmune condition is. And then also we learned that microbiome has ability to play a very important role in epigenetics. And this is something that we have learned, and there are a lot more studies that's being done. Just because you carry certain genes, it doesn't mean you're going to get the disease. And even when they looked at the twins, looking at based on their nutrition and lifestyle, even though they both carry the same gene, one may actually turn on the gene and develop certain disease, and one may not. And microbiome actually plays a very, very important role. And also the inflammation really resides and starts from our gut. And that's why gut health is so critical for our overall well-being.
Yeah, I couldn't agree more. I've been on this like learning journey of gut health recently over the last year and a half or so. But so I love that you talked about leaky gut and defined that, and you've talked about the microbiome being kind of the diverse nature of all everything that lives within the gut. So we want diversity, and so this is something that I know I fell victim to, and I know a lot of people who struggle with pelvic floor dysfunction fall victim to, is that they start to understand what foods may contribute to symptoms, and then they will start to limit their choices and only stick to ones that may not contribute or exacerbate symptoms, and therefore they're not exposed to the diversity of food, which can directly influence the microbiome as well. Is that correct? So how do we promote diversity to feed all of that good bacteria that's in our gut?
That's an excellent question. And what's very common, and I think that I hear these days, is that my body it doesn't tolerate plants, or doesn't tolerate fiber. I get bloated, I get very gassy, and people think that is a bad reaction. What that tells me is that they really have a poor gut health, and they don't carry the bacteria that can actually process all the different kinds of fiber. And so we tell them, well, you got to start slow. Average Americans consume about 10 to 15 grams of fiber per day. And that is virtually next to none. And even the recommendation dose is about 35 grams per day. I truly believe that's not enough. That's the bare minimum. And where we want to go is the goal and target is about 60 grams to 100 grams per day. And that's quite a bit. But you can't do that overnight, or else you are going to be really uncomfortable and no one's going to be happy, standing around you. But being bloated and being gassy is normal. Okay? And so what we recommend is based on the study for people to have in order to have a diverse a microbiome, they also have to eat a diverse plants. So what we recommend is eating about 30 different kinds of plants per week. And that seems daunting. However, I mean, it includes not just different types of green leafy vegetables, fruits, beans, lentils, whole grains, but also different kinds of spices and herbs that you might be utilizing. So if you are making a dish, they may have a lot of different ingredients. So they all count. But we just want to focus on diversity. And a lot of people focus on, oh, can I get probiotics? Either taking supplements or eating fermented food like kimchi or sauerkraut. However, you don't really know what kind of bacteria and how diverse of a bacteria that you're actually going to be consuming. So the best way to develop a diverse microbiome in your gut is eating as many different kinds of plants as possible. So prebiotic is essentially the fiber. And so the focusing on the fiber and then different kinds of plants, that is going to help you increase the diversity of the microbiome. And then of course, and there are other things that you can do to really expand the microbiome, because the healthy soil bacterias and the healthy gut microbiomes are essentially the soil bacteria. So I always say, I recommend you get a pet, especially a dog, because when they go outside, they bring all the healthy soil bacteria from the outside to inside, and being next to them, you naturally share the microbiome with them. And then also not over sanitizing. This has been challenging because of the pandemic time, but people before that, it just washing their hands with the antimicrobial soap rather than regular soap, and then the different types of ointments, and over sanitization and has really hurt development of microbiome, or even in the dishes that you wash with as antimicrobial soap, which naturally, if it's not thoroughly clean, you consume it, and then it could be killing the microbiomes in your gut. Overconsumption of antibiotics, because every patient with the common cold that comes into clinic, first thing is, I want an antibiotic. Well, for what? Most common cause is the virus, and antibiotics is not going to do anything. It may have some placebo effect. So those are the things that we want to focus on to really expand the diversity of microbiome.
Yeah. It's something even so I was reading a book called Fiber Fuel that talks a lot about diversity, and even in the last, I think 2 to 3 weeks, I've really made a concerted effort to have a different something. So maybe I would have a smoothie for most lunch times. I would make sure that it's a different type of a smoothie with different ingredients in it, rather than the exact same smoothie each and every time. And I've noticed a difference in terms of my bowel movements. So that's interesting to me. But one thing I want to touch on quickly before my next question is going back to what you talked about with fermented foods and probiotics. So they are right now, of course, promoted as a way to improve gut health, and so people are jumping on the bandwagon of buying kimchi and sauerkraut and even making their own potentially. But you're saying that if you eat a diversity of foods, those can play a role, but they don't necessarily have to be there. We shouldn't be using them as a way to accommodate for potentially a lack of diversity in our food. Is that accurate?
Yeah, that's correct. And so, typically I'm not, stating that you shouldn't be eating sauerkraut and kimchi, because, I consume kimchi on regular basis, because I'm Korean and it comes from Korea, and not only they're delicious, but they're extremely healthy. And so consume them, but don't just rely on them. And what everyone tends to focus on is that magic pill. They're not eating diverse and they're not eating a lot of plants, but they're eating kimchi and sauerkraut, and they think, okay, I should have a perfect gut health and I should have diverse microbiome. That's not going to happen. It's only one of. Even the nutrition alone doesn't do it. I mean, you got to there's a lifestyle modification that you have to participate in order to truly optimize it. So even sleep. And because of the microbiomes also have a circadian rhythm, and it has to be in line with our own circadian rhythm as well. And then also, there's certain supplements that the certain vitamins that people lack, like such as vitamin D as an example. And especially if you have dark skin, because of the melanin, even you're out in the sun, you're not going to be able to develop vitamin D. And most people spend their time inside. So unless you're going to be, shirtless between 10 a.m. and 2 p.m. and depending on the part of the world that you live in, and get a certain amount of time in the sun, you're really not going to get the optimal level. You may get bare minimum normal range vitamin D, but you need a lot more than that. And so we definitely recommend people supplementing with vitamin D. And there are other things that certainly can do lifestyle wise. I recommend doing time restricted eating. Some people call it intermittent fasting. So not eating late at night, especially because again, that goes back to the circadian rhythm. Respecting the gut microbiome circadian rhythm is going to create an environment where they can thrive. So those are some of the other things that you could do. But yeah, definitely, not just relying on things like probiotic supplements, or because they're only limited. And the probiotic supplements may carry only 12 different strains. But as I mentioned before, there are 100 trillion microbiomes in our gut. And so, and then things like the kimchi and sauerkraut, they're great, healthy food, but you definitely want to do more.
Yeah, yeah. I love that approach. I really do. I think that's amazing. So back to another thing that you said earlier with regards to parasites. So there's a lot of, because the world has now become focused on gut health, and now it could be because I work in the wellness space and I'm attracted to wellness information. So I maybe not as many people know about this, but there are a lot more people who are going through gut like GI map tests. So they're getting poop tests. And that can identify things like, different bacterias and parasites that you may have if you had something like SIBO or, all sorts of things. So do you believe there's value in those tests? And like with regards to, say, H. pylori bacteria and parasites, do you think there is a food approach to be able to address those? Or is there something like, do we need medication to rid us of parasites, or do we need to get rid of parasites? Are they maybe providing some benefit to us?
Yeah, I think, well, it all depends. Parasite is such a general term. And so
Yeah.
there may be certain ones that may cause certain type of disease, but overall it is a normal part of our body. And then, and also different types of bacteria. But there are certain ones, let's say you have H. pylori, and then you're suffering from, ulcer, then they definitely need to consult with their gastroenterologist, and may need to be on antibiotics to get rid of them. But being mindful that also at the same time, it's tricky because using the antibiotics, that could definitely negatively affect your gut microbiome. Then those are the times when you really do need to focus on, let's say, perhaps taking the probiotic supplements and focusing on the sauerkrauts and kimchi and things like that. But there are a lot of different tests that's available for people. I think right now there's a limited evidence and to be utilized in the type of clinical setting. So I think it's a good information to have, and if you can afford them, but it's definitely not necessary. Like, for example, I've never had a test. And even though it was offered to me, because it wasn't really necessary, because in general health, I have very optimal health. And then ever since I've gone plant-based, and then make sure I hydrate myself. Before I was like the typical North Americans that lived with constipation, and United States is a state of constipation. Majority of people live with constipation, and because of dehydration, and that's another a major factor. And then that leads to constipation as well as the headache. And once I switched my nutrition, made sure I stayed hydrated and modified my lifestyle, it's, going to the bathroom is like the easiest thing ever. And before, it was challenging. And then some of my patients come back and say, they go to the bathroom once a week. Like, no, some they heard somewhere that's normal. No, it's not. And it's not normal to be carrying around that type of toxin in your system, and that could lead to a lot of other problems.
Yeah.
But once you optimize it, and then you don't even think of it, it just you become very, very regular.
Yeah. Yeah. Yeah, that's interesting what you say about the testing, because I think, for speaking personally for myself, I was so determined to right the ship, so to speak, and get my health back. And I was pursuing doing all of this testing, and the diet made a huge change for me in taking out alcohol. And I got to the point where I still wanted to do the GI map test, but I really didn't have major symptoms. Like
Hmm.
so I was, afterwards I'm thinking, well, sure, this would tell me that, okay, now I need to go get rid of parasites and I need to address this. And, it points things out, but I don't want to be a pill popper. And I think that, do I feel terrible? No, I actually feel really good. So maybe I just carry on with parasites,
Yeah.
and, yeah, so that's really interesting what you say. And I think maybe I like the philosophy of test, don't guess, but at the same time, I think we can sometimes have too much information, maybe that starts just down the path of getting a supplement for this and trying to, and pretty soon you have this like army, and you can't even remember what time of day you're supposed to take that one, and don't do this, and it becomes very high maintenance. So um constipation, so this is really like one of the main biggest topics that gets talked about in pelvic health. We want to prevent it. People who have a rectocele, where the rectum's bulging in the vagina,
Hmm.
can, especially if they are constipated, can experience more challenges, but it can also lead to or contribute to constipation if the stool's getting stuck in that little bubble. So this was my life for many years. Um, you talked about, so getting upwards of 60 to 100 grams of fiber, which is,
Hmm.
I usually say around 30 to 35 grams. So I've been in
Hmm.
that recommendation, and that's
Hmm.
most often I'd say I'm probably somewhere between 30 to 40, maybe 45. So I'm going to be interested in myself. I'm going to now start to investigate going slowly higher. But the
Hmm.
other piece you talk about is hydration. So general rule of thumb, most people will say drink half your body weight in ounces. Do you agree with that? Or what do you think we should be aiming for from a hydration perspective?
Yeah, I think also a lot of people, here drink like 6 to 8 cups a day. I think that's a too small amount. And what I typically recommend for in general adult is at least close to about a gallon a day. And then you'll see me like I carry around. You can't quite see it there, but I carry around a gallon of water everywhere with me, and constant reminder that I need to be hydrated because when you're working, sometimes you forget. And so, or another way of thinking about it is every hour you should drink a cup of water, right?
Yeah.
And then so throughout the day that comes close to being about a gallon. And then, or another test would be if you're urinating, and it should be pretty much clear and just have a light yellow tint. And that's another way of testing it. But I strongly recommend everyone drinking about a gallon, and most people don't. Most people really live in state of dehydration, and then the way they hydrate is through coffee or alcohol, which really dehydrates them even further, right? And so I think that's one of the major issues with a lot of people, especially with constipation. So two main things is that lack of fiber, because most people are severely fiber deficient, and not only leading to constipation, but many other chronic disease, but also hydration.
Yeah. Yeah. Okay. So you're confirming lots of that I've been reading about, and will now start preaching. And the final thing I want to ask before you go is about magnesium. So it's one of those other things that it has become potentially, I know lots of people can be deficient in magnesium, but I also think it has become a bit of a crutch in the pelvic health world from a pooping perspective. So there's all sorts of strategies to avoid constipation. And again, coming back to what your original point is building the diversity and increasing the grams of fiber should be enough. But is magnesium something that you think, like, so magnesium citrate is typically the one that would be prescribed that would have the most laxative type
Hmm.
effect for people, and there are a lot of people who take it. A lot of people
Hmm.
would say that many women are deficient in it.
Hmm.
What's your experience with magnesium specifically for the female population, and is it something that you think is beneficial, or should we be starting to kind of wean off of that?
Yeah, so if you're eating lots of plants, especially dark green leafy vegetables, you are going to get ample amount of magnesium and the healthy amount. And so until you are able to make transition, if you need it, I totally understand it. But however, I think most people will realize that once they consume lots of green leafy vegetables, and what we propose to all our patients is the goal should be like about a pound of green leafy vegetables, especially if they have some sort of disease. And as you mentioned, I know you do it, but utilizing smoothies to consume high quantity of green leafy vegetables. But that's like one of the best source for magnesium. And that's part of the reason why they also, if you consume a lot of green leafy vegetables, you really don't have any issues going to the bathroom, because you are getting the magnesium from the natural source, and you're not having to, supplement through, magnesium citrate and or any other source.
Right.
So I strongly encourage people to make that transition, because then it's not only great for your constipation and your gut health, but also it's going to be amazing for your heart, because it's still the #1 killer in this country. And all the westernized countries are the heart disease, followed by cancer. And within 10 years, cancer is going to become the #1 and surpassing the heart disease. But still, right now is the heart disease. And one of the best way to prevent and reverse that is by eating a lot of plants, especially green leafy vegetables, because it has a lot of vitamins and minerals, like the magnesium. But it's going to also help you produce a lot more nitric oxide, which is one of the most important molecule in our body. And you need an organic nitrate in order to produce that. And then also you need to have the healthy gut. So they all play integral parts. And so, and I think your audience and your followers and your clients will definitely be able to benefit and would no longer need, hopefully will no longer need magnesium citrate to deal with the constipation.
Yeah. Yeah. One more quick question. Sorry, I forgot to ask you. What's the difference between plant based and plant forward? So I hear those terms used quite a bit now. Again, there's like people like to use trendy terms.
Yeah.
So what's the difference between the two of them?
So when you say you're typically plant-based, that means most of the time you're 100% plant-based. But but recognizing that not everyone can become 100% plant-based, and certainly I'm 100%. I do whole food plant-based, and I really consume. I do not consume a lot of processed food. It has to be either whole food or minimally processed food. But still, we don't want to discourage people. And a lot of people think, oh, I can't be 100% plant-based, so I'm not going to do it. No, and so we encourage people to eat more plants. So when they say plant forward, meaning really focus on plants. Even you're eating meat, maybe perhaps reduce the size, and then have certain days where meatless Monday, as an example, and meatless Thursday. You don't have to have the meat every single time you sit down and eat. And because there are certainly negative consequences that comes with different types of meats. And so, but you can also overcome that challenges by adding a lot more fruits, vegetables, legumes, and whole grains. That's going to give you the antioxidants, polyphenols, phytochemicals, and everything that you need in your body to truly optimize it. And a lot of people think that, oh, well, if I eat just plants, I can't, I won't get enough proteins. And so, well, then I usually, come back and say, well, how do you get your fiber? Right. And but you can get all the proteins that you need by eating plants. And so, but if you have to eat meat, that is really for just a personal pleasure. And then so I tell my patients, reduce the size and then overcome it with adding lots of plants. So when they say plant forward, that's what they mean. Eat a lot more plants.
Yeah, got it. Amazing. Where can people find more and learn more about your work and potentially connect with you if they had any other questions?
Yes, I'm pretty active in social media. And so in Instagram, it's Dr. 1MD, the same handle for the Facebook as well. If people want to learn more about whole food plant-based, we have a free nutrition guide. And so you can send me a message, direct message me on Instagram. And then we'll be happy to send you and send everyone a free plant-based nutrition guide.
Amazing. Amazing. Thank you so much, Dr. Wan. I am so appreciative of your time and your knowledge, and really excited to learn more from you on Clubhouse. And I again really appreciate your time today and sharing your wisdom with my community. Thank you.
Yeah, thank you. I had so much fun and truly an honor. And let me know if there's anything I can do in the future.
Awesome. Thank you so much.
Okay. Good night.
Bye-bye.